Welcome to this short video looking at how to ensure safety as part of Unit 2 working in health and social care for the BTEC Health and Social Care course. So when it comes to ensuring safety, this is an essential feature of health and social care. Any health and social care setting is a legal right to ensure that anyone in that setting is protected, and safety is a really important aspect of working in healthcare. The first of these is a risk assessment. So the first thing most healthcare settings, or all healthcare settings, do will be a risk assessment. Now, a risk assessment is basically a way of identifying potential risks or hazards that could cause harm to an individual in your setting, and then putting actions in place to reduce the impact of that risk. A risk is essentially how likely someone is to come to harm, and obviously will be harmed by a hazard. Hazards are anything that could be dangerous. So this could be stairs, cables, it could be how waste is handled and disposed of. Anything that's a source of danger is a hazard. You assess the level of risk, of likelihood of that causing harm, and that's where a risk assessment comes from. Now, it's the responsibility of employers to ensure that health and safety is really protected when working in healthcare settings. The Health and Safety Work Act of 1974 ensures all employers and employees must maintain a safe working environment. As part of this, employers need to make sure that they have a health and safety check. They need to be doing these risk assessments, looking for any potential hazards, sources of danger, and they need to update these records regularly, keep staff updated of assessments, risk assessments, and make sure they provide training to protect all their workers, as well as record any accidents that have taken place. Employees also have an important role when it comes to preventing risk and injury. So employees must take responsibility of their own safety. They must be aware of these risk assessments. They need to identify their own risks and report and update these risk assessments as they go. If they find damaged equipment, anything that's at risk to other workers, they have to report it. So therefore, they're protecting others, people, as well as themselves. When it comes to protection from infection, another part of keeping people safe, there are two aspects to this. So there might be the clinical waste side of protection from infection. So workers who are handling blood, urine, saliva, other bodily fluids that could be a source of infection. The best way to do this is to wear PPE protection, wash hands, keep soiled equipment separate from clean materials, store them away or dispose them. So for example, like protective gloves or needles or syringes are put into sharps boxes, which are often yellow, and then are incinerated. So this is all about keeping surfaces clean, wearing protective clothing, washing hands to prevent the spread of infection or disease. Hazardous waste, on the other hand, these are substances which are slightly more harmful. So this could be equipment, this could be soil dressings, this could be flammable or explosive materials that people may handle. It could be poisons, it could be corrosive. So it's anything which could harm someone. And it isn't just necessarily medical waste, but these could be chemicals or a piece of equipment that people use. So again, in the case of hazardous waste, these will need to be disposed of properly, and this could be in the same way as clinical waste, where biological matter is put into yellow bags and incinerated. Soiled laundry will be put into red bags, which are then washed at incredibly high temperatures to kill any bacteria. Blue bags might be for medical equipment that needs to be sterilized and repackaged for further use. So this policy comes under control of substances hazardous to health, or the COSH regulations, which are really important for helping to keep control of anything that could be harmful to individuals. And effectively, in most cases, these substances are just destroyed and incinerated. Further to this, we have lone worker policies. So essentially, any setting where a care worker or some kind of care professional is going to be working on their own, often happens with domiciliary care, where a care worker goes into a person's home. Again, a lone worker policy would need to be put in place. Lone worker policies generally cover a lot of what we've already mentioned: risk assessments, COSH training, but it also covers stuff like making sure equipment has been provided, that health and safety is met in terms of providing first aid training, first aid equipment, So this comes under the care manager's responsibility. So any care manager sending staff to work on their own in a setting needs to make sure they're providing those resources, that equipment, that training, and those checks. Safeguarding is another really important part of protecting people, ensuring safety. So this is about identifying potential risks, looking at whether people are experiencing harm, abuse, neglect, and essentially having a safeguarding policy in place in which you are protecting the people you're working for. So a health and safety policy often will have links to safeguarding, where you are protecting the clients, the people. And it's more about identifying or observing any potential signs of abuse, neglect, or potential risk, and reporting it to a safeguarding officer who will pass it on, depending on the age of the person. So if it's children, it might be going to maybe potentially police or other agencies, but essentially you're protecting people. When it comes to accidents as well, we have to make sure we are reporting them. So any accident needs to be reported. We use this system called RIDDOR. So it's the reporting of injuries, diseases, and dangerous occurrences. It was introduced in 2013. So essentially, any injury, any accident, anything that happens in the workplace which needs to be recorded. And when you do this, you record the date, the time, what the hazard was, who was affected, how they were affected, and essentially this needs to be updated. When the CQC, when any regulator will come in to do inspections, this will be something they want to see. Because again, it highlights that if you've got lots of accidents happening, it suggests maybe your risk assessments, your health and safety training, your setting is not suitable for what's needed. And also provision of first aid. So if you are providing a service, you need to make sure you have first aid facilities or first aid trained individuals in order to carry out immediate medical care if someone becomes injured or hurt in your setting. This would also then be followed up by recording the incident on the RIDDOR report. And last but not least, the other ways we keep people safe. So we need to have a complaints procedure. Any setting which works with people will have a system in which people can make complaints. Now, this is probably sometimes if someone is not being treated properly, if there are safeguarding concerns, safety concerns, and patients feel threatened or under sort of not being protected, this is a good way to make sure that those concerns are raised and addressed. Often if someone makes a formal complaint or a complaint, they have to be dealt with quickly. They have to show outcomes have been met or concerns have been acknowledged. And essentially, again, this will be something else that CQC and inspectors will look at. Is there a complaints process? Are people making complaints? Are they being dealt with? Not a specific safety feature, but again, allowing someone to make a complaint about the quality of care could be a way of making sure that people are protected from injury or maltreatment. And so again, complaining is really key. We also have whistleblowing, which links to this. So again, it's part of the complaints process. If you make a formal complaint, you don't feel it's been addressed or dealt with, you can then seek the support or report it to other external agencies. That might be your regulatory body like GMC, NMC, HCPC. It could be going to the police, it could be going to the press, but essentially the goal is you're trying to bring about improvements and change. And finally, confidentiality. Confidentiality is part of this ensuring safety. You keep people safe by keeping their data safe. So one of the things about recording and storing data is that we need to make sure that we have systems in place to keep data safe, protected, and confidential. And essentially, we shouldn't have people looking at data that isn't up to them, or they shouldn't have any right to access. So this will all be coming under the storage information, but also the legal principles, the Data Protection Act, GDPR. These policies are important for keeping people's data safe in order to protect their data, their information about them. Okay, hope this has helped. So this is an overview of how to keep people safe in settings and obviously the importance of ensuring safety. As always, I hope this helps. Like and subscribe, tell your friends, all those good things. Thanks for watching.